I am Dr. Gülay Gök from Istanbul Medipol University Department of Cardiology. In this section, I will talk about evaluation of atrial functions. I have no disclosures. Left atrium is localized posteriorly heart chamber and contributes at least 30% of stroke volume. Modulates left ventricular filling through three phases: reservoir phase, conduit phase, and pump phase. In this diagram, we can see the left atrium functions. During left ventricular systole, after mitral valve closure, left atrium begins to fill with blood from pulmonary venous system. This is reservoir volume of left atrium. And after mitral valve opening, left ventricle begins to fill with blood from left atrium. This is passive filling of left ventricle, also called conduit phase of left atrium. And when left atrium contraction, after left atrial contraction, left ventricle fills, and this is active emptying of left atrium, and pump function and pump phase of left atrium. Left atrium is a predictor of diastolic dysfunction, and atrial and brain natriuretic peptides are stored in the left atrial appendage, and in especially congestive heart failure, those peptides are very important. When left atrium dilates, mechanical function gets impaired and causes atrial fibrosis and deficiency of atrial natriuretic peptide synthesis and releases. With sympatoexcitation and increase of renin-angiotensin-aldosterone system cause fibrosis in left atrium. What are the factors that affect left atrial function? Especially reservoir function effects from atrial compliance. And atrial contractility plays an important role in pump function. And atrial compliance and ventricular compliance are important in conduit function of left atrium. What are the methods to evaluate left atrial size and function? Though we can measure with all those methods. However, recently, left atrium anteroposterior diameter is not used solely method because of the left three-dimensional structure of the left atrium. Anteroposterior diameter is not enough to predict left atrial functions and size. We should also measure left atrial volume and transmitral flow velocities, pulmonary venous atrial reversal velocity, tissue Doppler imaging. And also in this section, I will talk about mechanical coupling of the atriums and 2D deformation analysis of the left atrium. Left atrium quantification, the American Society of Echocardiography and European Association of Cardiovascular Imaging has published in 2016 for recommendations of cardiac chamber quantification. And according to these guidelines, the left atrium anteroposterior diameter is measured from posterior aortic valve to posterior left atrial valve. And if we want to measure by M-mode, it must be perpendicular to the aortic valves. Left left atrial area can be measured from both 4-chamber and 2-chamber. The left atrium area is traced and should be spared. Pulmonary veins should be spared, and also mitral valve stenting area should be excluded during those measurements. 2D volumetric assessment of left atrium can be both biplane, area length, and Simpson methods can be used to measure the volume of the left atrium. In this video, I will show how to accurately measure maximal left atrial volume. Yes. We have to start from the end of the T wave to measure the maximal volume, and we should trace from the mitral valve annulus, and we should spare the pulmonic veins, and we should spare the stenting area, and this line should be parallel to the left ventricle. Yes. And in the same manner, left atrial minimum volume and preceding atrial contraction of left atrium can be measured. Those are the normal ranges of the volume of the left atrium. For maximal left atrial volume, 22 to 27 is the normal range. For minimum left atrium volume, 11 to 15 is the normal range. And for the preceding left atrial contraction volume, 15 to 20 is the normal value. For reservoir function, the differences between maximal volume and the minimal volume is correlates with reservoir function of left atrium, and conduit function is correlated with the differences between the maximal volume and preceding per-A volume of the left atrium. And pump function is, on the other words, active ejection fraction of left atrium is measured the differences between per-A volume and minimum volume of left atrium. However, among those measurements, left atrium volume index is most strongly associated with cardiovascular disease and most sensitive in predicting cardiovascular outcomes, according to this study from Journal of Echocardiography in 2006. I want to draw attention the gender differences of left atrium sizes, diameter, and volume. Women have a smaller volume when compared to men. Men have larger sizes of left atrium. However, left atrium volume index is not changeable according to genders. Women and men have similar left atrial volume index. Left atrium volume index greater than 24 is the only independent echocardiographic predictor of cardiovascular death outcomes and clinical predictors. And to predict left ventricle diastolic dysfunction, left atrial volume index greater than 34 is a predictor of left ventricle diastolic dysfunction. According to recommendations for the evaluation of left ventricle diastolic dysfunction by echocardiography, which published in this study in 2016 from European Heart Journal. To measure the 3D volumetric assessment of left atrium is most correlated with cardiac MR measurements when compared with 2D dimensional measurements. Both in Pearson correlation and Blunt-Altman analysis we can see that it is well correlated with cardiac MR measurements. 3D measurements can be performed by TomThinQ imaging systems. It is an offline software dedicated to measure left atrial volume. After alignment of the apical views, left atrial and the cardial borders are traced, both in the maximum volume and in the minimum volume. And then the software automatically calculates the volume. According to American Heart Association, left atrium volumes are greater than the 2D volumes. And there are differences between males and females. Females have a smaller size. 3D left atrial volume greater than 100 is a strong predictor of one-year adverse outcomes among patients with heart failure. Another method is that we use in the clinics, and it is one of the conventional methods that we use in the clinics. Thrice, we measure from the tips of the mitral leaflets by pulse wave Doppler measurement, both mitral E and late mitral A velocities. E velocity is E velocity reflects conduit phase, and A velocity reflects pump phase of left atrium. When in diastolic dysfunction, A velocity increases and A to A ratio is smaller than 1, and deceleration time gets steeper when in restrictive filling, especially in restrictive filling. However, this method is affected by age, loading conditions, and heart rate. Also, time velocity integral can be used to evaluate left atrial function. An increase in mitral E time velocity integral to mitral A time velocity integral is associated with an increase of atrial fibrillation in the Framingham Heart Study. Pulmonary venous atrial reverser velocity can be used when we place the pulse wave velocity 1 to 2 centimeters superior to left atrium inside the pulmonary veins. We can see those traces. The S velocity is correspond to reservoir function of left atrium, and T velocity correspond to conduit function of left atrium. TG Doppler imaging of left atrium is another conventional method that we usually use. The A prime velocity and E prime velocity are important to evaluate booster and pump function and conduit phase of left ventricle, and S prime velocity is correlated with the reservoir function of left atrium. In restrictive filling, A prime velocity decreases. And peak A prime velocity smaller than 4 is appeared to be highly predictive of cardiac mortality. To conclude, to show reservoir function, S prime velocity and pulmonary venous flow S velocity reflects reservoir function. Reservoir function is the global ejection fraction of the left ventricle. Conduit function is the passive ejection fraction of the left atrium, and E velocity, E to A ratio, E prime velocity, and pulmonary venous D velocity reflect conduit function of left atrium. Pump function is the active ejection fraction of left atrium. And A to A ratio, A prime velocity are important to predict pump function of left atrium. In this section, I will talk about atrial electromechanical coupling. Atrial conduction abnormalities can be seen in many diseases like diastolic dysfunction, rheumatologic heart diseases, and to predict atrial fibrillation. There are many studies in the literature that show delayed atrial conduction abnormalities in juvenile rheumatoid arthritis, like stroke patients, diabetes, and how to measure, and we should measure from both lateral mitral annulus, medial mitral annulus, and tricuspid annulus. We measure the beginning of the P wave to the A prime wave. This time is measured from both lateral mitral annulus and tricuspid valve annulus, and the difference between those measurements are called interatrial mechanical delay. And from medial mitral annulus, the time and the difference between the time from medial mitral annulus and tricuspid annulus is called intraatrial mechanical delay, and has been studied in thyroid dysfunction, stroke, atrial fibrillation, non-Dipper patients, and has been shown a delayed inter and intra-atrial electromechanical delay in those patients, as we see in those studies in the literature. The last one is left atrial two-dimensional deformation analysis, strain analysis. This is the strain analysis of left atrium. This technique is unaffected from the heart motion, heart rate. This is an advantage of this technique. It can be measured from both according to QRS complex and according to P wave. If we want to measure according to QRS, the first wave represents the reservoir function of left atrium, and second wave is the conduit function, and the latest wave is the pump function of the left atrium. However, according to P wave, in the first wave is the conduit function, and the latest wave is the pump function, and the reservoir function is the total of those measurements. According to ESC guidelines, we usually measure from according to QRS complex. In this video, I will show how to measure left atrial strain. We traced from mitral valve, from the beginning of the mitral valve annulus, and trace endocardial borders. And we should adjust atrial valves to optimize the image. And then the software automatically calculates the waves, the reservoir volume, the conduit function, and the reservoir function. Limitations of this method is accurately imaging and tracking the thin-valved left atrium and the current lack of consensus on normal reference values are the main limitations of this method. Left atrial dimensions are important in predicting development of atrial fibrillations, congestive heart failure patients, stroke patients, and transient ischemic attack. Prognosis and risk stratification using atrial volume and function. Patients are highest risk when left atrial emptying fractions is greater than 49% and left atrial volume index is greater than 38. Left atrial volume index greater than 38 is a powerful predictor of new onset atrial fibrillation, according to this study. And according to this study, in journal, which published in Journal of the American Society of Echocardiography, global left atrial strain was well correlated with CHA2DS2 risk score in patients with atrial fibrillation. In another retrospective registry-based case control study, which published in Journal of the American Society of Echocardiography in 2012, reduced strains are important in predicting stroke or transient ischemic attack. In another study, left atrial volume index and left ventricular ejection fraction, strain waves, and strain rates were independently associated with cerebrovascular accident and has a greater risk in left atrial stasis and greater risk in thromboembolism. And also the strain rates is a predictor of the success of the cardioversion. And also in patients with myocardial infarction, left atrial volume index greater than 31 is an independent predictor of left 5-year mortality. Right atrium. Right atrium has many structures and embryologic remnants like pectinate muscles, Tabeschian valves, Eustachian valve, and fossa ovalis. Crista terminalis is a boundary between inferior vena cava and superior vena cava. And similar with left atrium, right atrium has 3 functions: reservoir, conduit, and pump functions. Right atrium reservoir function predominates right ventricular filling under normal conditions with increased ventricular pressures favoring conduit function. A chronic volume overload state, such as tracts with regurgitation, significantly reduces the right atrium reservoir phase mechanics. Enlarged right atrium has prognostic importance in pulmonary hypertension, systolic heart failure, Eisenmenger syndrome, and pulmonary embolism. 3D right atrial volumes, those are the normal reference range, and similar with the left atrium, females have a smaller left atrium right atrium when compared with males. Strain analysis can be performed also for right atrium, and it is similar with left atrium. It can be both measured according to P wave and according to QRS wave. Apical 4-chamber view can be used for tracing. And thank you for your attention.